feeding time, there are many different intervention techniques to facilitate ease and productivity. These include modifications of position, food, utensils, feeding schedule, food presentation, mealtime environment, and sensory stimulation.
We are going to take a few minutes to inform you about environmental considerations and adapted utensils.
There are many things to consider when feeding a student. One consideration to think about is providing opportunities for communication during the mealtime. Meals are often social events, and we want to model this each and every time we assist in feeding a student.
Since this is a social event, just as we would not want to be rushed through it, neither does the student. Be considerate and make sure that you are providing adequate time and care between each bite throughout the entire meal.
Going along with the social aspect of mealtime, environment is another important consideration. Make sure the environment is comfortable, relaxing, and overall inviting. There should be proper lighting, minimal distractions, and opportunities to interact with their peers if they desire. Since we do not own any of the adapted utensils, we will be providing pictures and information on the next following slides.
We would like to note that in our demonstrations of jaw closure techniques, we omitted environmental, social, and other considerations in an attempt to focus mainly on the technical aspects of jaw closure assistance. Please always keep in mind the considerations during mealtime when providing assistance to anyone.
Hi, I'm Julia.
And I'm Liz.
Today we're going to talk to you about the 4 different techniques you can use to assist your students with jaw closure.
Before beginning the feeding process, there are some general rules that you need to follow. The first, you should wash your hands with warm water and soap for at least 30 seconds. Next, always greet your student and ask them how their day is going and talk to them about general things. The third thing you should do, if possible, is provide the student with options of food that they can eat.
Before providing any of these assisting techniques, there are some general positioning rules you should follow. First, you never want the student to be slouched. You always want them to be sitting as upright as possible. Their body should also be symmetrical with their legs and their arms down at their sides. When positioning, it is also important to always keep the student's head at midline. We want to do this to avoid the occurrence of any primitive reflexes. Hips and knees should be as close to 90 degrees as possible with feet flat on the floor. The feeder should be positioned sitting in front or beside the student, and if you're sitting in front, you should be at eye level or a little bit below.
The first technique that we're going to show you helps facilitate downward jaw movement and stabilizing the lip. In order to start this, you approach the student from the front. Your middle finger goes behind the jaw, index finger at the joint, and thumb on the chin. Julia, can you turn your head so that they can see? Now let's try out these techniques with food. For this, we're using cheddar bunnies. For the first technique, remember to approach the student from the front. Your middle finger goes under the jaw, behind the chin, index finger on the joint, and thumb on the chin.
The second technique we're going to show you helps facilitate the upward movement of the jaw, and there is no lip support provided in this technique. You approach the student from the front and place your thumb underneath their jaw behind the chin. This helps you facilitate upward movement. Now let's put this second technique into practice. Remember, approach the student from the front with your thumb under their jaw behind the chin. This helps with upward movements of the jaw.
This next technique can be provided for students who have poor head control and neck hyperextension. Support should be provided from the side or behind, reaching around the student's non-dominant side. The middle finger is placed under the chin, the index finger goes under the lower lip, and the thumb is placed on the cheekbone for extra support. For the third technique, remember to approach the student from the side or behind. Remember that your middle finger goes behind the chin, under the jaw, index finger under the chin, and the thumb on the cheek for support.
The fourth technique is similar to the third technique because it helps with poor head control and neck hyperextension, but it also provides upper lip control. Support should be provided at the side or behind the student. You place your ring finger under the jaw behind the chin, your middle finger under their lower lip, and your index finger above their upper lip. Now let's practice this fourth technique. Remember to provide support from the side or behind. Place your ring finger under the jaw behind the chin, middle finger under the lower lip, and index finger above the upper lip.
The best way to become comfortable with each of these techniques is by practicing. Now that we have shown you 4 different jaw control techniques, take a few minutes with a partner and practice each on each other. We hope that you have learned the basics of assisting a student with feeding, focusing mostly on jaw closure techniques. Please always remember to keep in mind the helpful tips that we have provided. If you have any further questions or would like an opportunity to practice more, please do not hesitate to contact either of us.